Good evening, ladies and gentlemen. First of all, I would like to introduce myself. My name is Muhammad Nur Iqbal. I am the student of Bachelor of Medical and Health Science, Open University Malaysia, Kota Kinabalu Learning Center. Okay, so for today, I would like to give a speech or practical session regarding our microteaching session regarding visual acuity. Okay, first of all, I would like to give an introduction about this topic regarding visual acuity. What is visual acuity? A visual acuity test is an eye exam that checks how well you see the details of a letter or symbol from a distant, specific distance, and also known as clarity of vision or sharpness of vision, refer to a person's abilities to see a small details. It is usually expressed as a fraction that measures a patient's ability to see an object from 20 feet or 6 meters away compared to a person with normal vision who can see the object clearly from a longer distance. Visual acuity is dependent on a combination of optical and neural elements, including the health and functionality of the retina, the sharpness the retina form image, and how well your brain can interpret sensory inputs. There are two common causes of a poor visual acuity, which is refractive error and neural factors. Most of the time, lower visual acuity can be corrected by eyeglasses, contact lens, or refractive surgeries. What is visual acuity test? Visual acuity is a measure by chart, optical instrument, or computerized test. Eye chart are the most common method of visual acuity testing. They show several rows of octotypes, example numbers, letter, or symbol, that get progressively smaller toward the bottom. The most frequent use eye chart use are Snellen chart and tumbling E chart. The test tells your eye doctor exactly what prescription you need in your glasses or contact lens. Okay, so this is the example of our Snellen chart, and the E chart like this. This is what we call E chart. Alright, so normally we use the Snellen chart to a person who can read the numbers, but you can use each chart if the person unable to read A, B, C, D or the object. Okay, this is very easy. Okay, normally a value of 6/6 is considered to be optimum or perfect vision. Okay, so normally we are right about 6/6 if the person has a good eye vision. Okay. Why is this test used? This test tells the doctor if you need prescription lenses, as well as what prescription lens you need to see properly. Okay. The result of the test are used to diagnose the following condition. The first is refractive error. In this refractive error, there will be astigmatism, which is a refractive problem with the eye related to the shape of the lens, which caused by blurry vision. And the second, hyperopia, which is also known as farsightedness. And the third, myopia, which is also known as nearsightedness. And last, presbyopia, a condition related to aging that causes lens of the eye to have trouble focusing. Next, the result of the test can help diagnose the following condition. The neural factor, which is a macular degeneration, is a condition related to aging that affect your child's central vision. And the second is retinal vessel occlusion, which is a condition that causes the small blood vessel near the retina to be blocked. And the third, retinitis pigmentosa, is a rare genetic condition that damages the retina. And the last is a retinal detachment, when the retina detaches from the rest of the eyes. Okay, this is why this test should be used, okay, to diagnose of this condition, right? And the next, who should be tested? Okay, first group is a healthy adult under age 60 and above who are not experiencing vision problem, should have a refractive test every 2 years. And next, the children should have refractive tests every 1 to 2 years, starting at no later than 3 years of age. Okay, and the second group should be if you are currently wear prescription glasses or contact lens, you should have a refractive test every 1 or 2 years. Okay, this is allow your doctor to figure out what prescription is necessary if or as your eyes change. Okay, and the third group, if you have diabetes, you should have an eye examination every year. A number of eye conditions are associated with diabetes, such as diabetic retinopathy and glaucoma. According to the American Diabetic Association, people with diabetes are at a greater risk for blindness or other than Americans. And the last group, if you are over 60 or have a family members of having history of glaucoma, you should have also have a refractive test every year, every single year. Glaucoma occurs when pressure builds up in the eyes, damaging the retina and the optic nerve. So this is the people who should be tested for the visual acuity. Okay, understood? Alright. Next, we are going to do some practical regarding these tests. Okay, first, what we need to do is prepare our equipment. The most important thing we must have this one. This is what we call a Snellen chart. Okay, and then the next is pinhole occluder, and then the distance. You need to measure the distance about 6 meters for the first time, and the last is torchlight. Yes. Okay. So this is we need when people or the patient unable to read the Snellen chart from the 1 feet. Okay. All right. During the eye test, patient will be stand at a certain distance from this visual acuity chart. Starting, we are going to start with 6 meters, okay, and then going to 3 meters, and finally 1 feet. Okay, there is a distance we need to measure first. Okay, right. The element such as distance from the test chart and lighting condition must be standardized. Okay, and the patient will cover their right or left eye with the pinhole occluder, either left or right side, and read the chart starting from the top to the bottom of the Snellen chart, and they will switch the eyes and then repeat the same procedure from the right and left, from top to the bottom. Okay, I will demonstrate how we are going to perform this test. Okay, I need one volunteer to help me to perform this visual acuity. From the first, we need to adjust the distance The starting point should be at the 6 meter from the Snellen chart, and then we are going to use either using pinhole or without pinhole. Okay, so the patient should be tested with right or left eye first. Okay, which is either left or right. So the patient can be tested without pinhole first, and then the examiner will ask the patient to read from the top to the bottom of the Snellen chart. Okay, but if the patient unable to read the Snellen chart, we need to adjust the pinhole. We close the pinhole. Okay, then the patient should be tested with pinhole. Then the same procedure with the next eye. Okay, but if the patient unable to read with the pinhole, we need to adjust the distance from 6 to 3 meter. Okay, come here please. Okay, the 3 meter should be also test from the left or right eyes and with the pinhole. Okay, if the patient able to read from the top to the bottom, it's okay lah. Okay, the next is 3 meter. If the patient unable to read from the 6 meter and from the top to the bottom, we need to adjust the distance from 6 to 3 meters, and then using the pinhole. Okay, so we can start again from the 3 meter and then close the pinhole. Okay, and then ask the patient to read from the top to the bottom, and then the result should be right on the number of the patient able to read. Okay, but if the patient unable to read with the distance of 3 meter, we need to adjust the distance to 1 feet. Okay, an example like this. If the patient unable to read the Snellen chart, we are going to use the counting finger. Okay, okay. The procedure is like this. Just close the eyes using the pinhole. Okay, just use one hole, and then we are going to show the patient using the finger 1, 2, or 3. Okay, if the patient unable to read all the counting finger, you need to use the hand movement. Okay, if the patient also unable to read the hand movement, you need to use the torchlight. Okay, this is the torchlight. The torchlight is the final equipment we need to use. Either the patient able to see the light. Okay, we can ask the patient to read to identify if he can see the light or not. Then the result we can write down either perception of light or non-perception of light. Okay. And next, how to read the result of a visual acuity test. Visual acuity is typically measured in fraction or decimal. The first number in the fraction refers to the testing distance, and the second number refers to the font size. Most visual testing in the United States use the Snellen letter chart, which require a test distance of 20 feet or 6 meters. Normally in Malaysia, we are using in meters. Okay. The normal vision is 6/6. Okay. So this is how we write the visual acuity result. We should start with right or left eye. Okay. Then with pinhole or pinhole. Okay. So this is how we write from the 6/6, 6 or over 60, 3/60, 1 feet, counting finger, hand movement or precision of light or non-precision of light. Okay, so thank you very much for your attending this CLE, and I hope you can understand how I'm going to present. Thank you.